with something that is real and kind of heartbreaking, and it makes you angry, but also you have enormous sympathy for these, certainly so many of these victims. So it's got all those great elements.
Just to be clear, you're blaming numerous deaths in your town on just one medication.
Yes. I am.
Dopesick takes place primarily between 1996 and 2007. This show follows the U.S. Attorney's investigation of Purdue Pharma. We also follow a DEA investigator who's bringing a case against Purdue Pharma. And then we're in the halls of Purdue Pharma, in which we watch them lie, manipulate, deceive in their marketing, promotion, and sale of OxyContin. And lastly, we're in a small coal town where we see a country doctor played by the great Michael Keaton. And as we see him, deceived by a pharma rep into thinking that OxyContin is less addictive and safer than other opioids, and he starts prescribing it to his patients.
Purdue continues to lie about the drug's safety to doctors, to patients, and the FDA. We have a major case here.
Dopesick's an important show and riveting entertainment. I mean, I don't think this story could be told effectively in any other way. I think that there's so many elements to this issue, and it's so important to flesh out each one.
Danny does such a good job in the writing that it'll bring like some very specific stories and some specific faces to kind of the data that we are getting more and more familiar with just how addictive opioids and drugs like OxyContin are.
On the sort of macro level, it is very clear that they did everything they could to continue selling drugs that they knew were addictive to people, and downplayed the addictive qualities of those drugs so that they could keep selling those drugs, while all the while depicting the people who were falling prey to the addiction as users.
This is not our fault. These people want to be addicted.
How could you not be angry at something as large as Big Pharma, and in this case, we gotta say it, the Sackler family, and people who, most of them are what we could categorize as the have-nots, or the less they have less, and they're the victims. How do you not get angry?
You too, young lady. You take it easy, all right?
I know, Doc. It was really, really, really taxing. It was probably one of the harder things I've had to do. It was very important to me, though. It was very, very important that I was doing it right and that I was playing those emotions correctly and not sugarcoating anything, but not doing anything too subtly either, because I think that in order for people to really connect with these characters, and especially Betsy's side of it, is to be really honest about it and real.
The most shocking and disturbing thing was not that this opioid crisis was something that just we all got carried away with, and how did this happen? It was actually very intentional and very methodical in terms of making sure that this drug was successful, and successful meaning profitable.
One of the things that the show does not shy away from is showing how there was a culture of fraud and bribery and deceit, and that those were pillars to the success of the drug in the American market.
It could soon become Purdue's first billion-dollar drug.
Heroin comes with such a connotative weight to it. Everybody knows, heroin is bad. I hope that, this show provides kind of access to people who may kind of still set them apart in their mind, because these are pharmaceuticals. If they're prescribed by a doctor, if they come from a medical professional, that, there's no way that it could be as bad as, heroin, but it really is.
Can't believe how many of them are good now.
My view on addiction as well has changed too, just in the way I think about it, because I have so much empathy towards people that are going through it, because it does just really take over.
And I think that this show asks a really great question, which is, why are we in so much pain? Why? And what does pain look like for different people? And how does that pain motivate people to make decisions in their life that may or may not be questionable? And ultimately, it's a story about the people behind this horrible, horrible systemic issue.
I think I can make this the biggest drug in the world.
Dopesick covers the American family's dirty little secrets. Don't look away.
you.